Hi, this is an educational video discussing how to perform a routine tracheostomy cannula change. Routine cannula changes in the hospital should be done once per month or as needed to prevent obstruction or bacterial colonization of the trach tube. Outpatient trach change timing should be discussed with your child's ear, nose, and throat doctor. Always have all the supplies at the bedside prior to the procedure taking place. This procedure requires 2 people. The supplies include 2 tracheostomy cannulae, 1 current size and 1 smaller size, an obturator, water-soluble lubricant, tracheostomy ties, a dressing for the trach, and gloves. For the step-by-step procedure, first you will don gloves, and the person actually changing out the tracheostomy in the hospital will use sterile gloves. Next, have the new cannula ready at bedside prior to removal of the old cannula. Using sterile technique, place obturator inside new cannula. Water-soluble lubricant may be placed over the tip of the tube or the obturator. This is only as needed if you have to use it. Use a very small amount to prevent obstruction of the tube if you do. The tip of the tube should be kept sterile at all times. With routine cannula changes, perform suctioning and stoma care prior to the tube removal. These 2 techniques are discussed separately in another video. If the trach tube is cuffed, take out all of the water prior to removing the tube. This is very important. If needed, increase oxygen to the patient at this time. Then, remove tracheostomy ties and gently remove old cannula following the natural curve of the anatomy. Have scissors available if unable to remove the trach ties. Now quickly take new tube and gently insert into the stoma following the natural curve of the anatomy. Do not force the tube, it should glide easily. If tube is forced, this may cause a false tract formation in the soft tissues between the neck and the trachea. If unable to insert the tube easily, attempt the cannula change with the next smaller size, then notify ENT. Once the new tube is in place, immediately remove the obturator. Connect ventilator tubing. Secure with tracheostomy ties. Lastly, reinflate the cuff if one is present on the tracheostomy tube. Apply dressing as previously described. If needed, increase oxygen further to patient to assist with recovery. And lastly, note date of tube change, appearance of the old tube, easy rise of the chest, condition of the stoma, and patient's tolerance to the procedure.